$2,210. That is the median amount Americans lose in a single Medicare scam phone call. One call, gone. And Medicare fraud costs this country over $100 billion every year, making it one of the largest sources of theft in the entire United States. Stay with me because in the next 10 minutes, I am going to walk you through the 5 most dangerous Medicare scams targeting seniors right now in 2026, with real examples of exactly what scammers say, why so many people fall for it, and what you can do immediately to protect yourself. Let's go. Scam number 1, the fake Medicare card replacement. This is the most consistently reported Medicare scam every single year, and it is still working in 2026. Here is exactly how it happens. You get a call, sometimes an email, sometimes someone even knocks on your door. The person claims to be from Medicare and tells you that you need a new card. Maybe they say your current card is expiring. Maybe they say Medicare is upgrading to a new chip-enabled plastic card. Maybe they say there was a security breach and your number has been compromised. They ask you to confirm your Medicare number, your Social Security number, or your banking information to process the replacement. Here is the truth. Medicare cards do not expire. Medicare is not currently issuing new plastic cards or chip-enabled replacements, and Medicare will never call you out of the blue asking you to confirm your personal information over the phone. Your current Medicare card, the white paper card with your name and Medicare number, is valid. If you ever genuinely need a replacement card, you can request one for free at medicare.gov or by calling 1-800-MEDICARE. That is 1-800-633-4227. What happens if you give scammers your Medicare number? They use it to bill Medicare in your name for equipment you never received, services that were never provided, and procedures that never happened. Your number is also worth money on the dark web, where criminals buy and sell stolen Medicare identities. If someone calls claiming you need a new Medicare card, hang up immediately. Okay? Scam number 2, free medical equipment fraud. You receive a call offering you a free back brace, knee brace, mobility scooter, or diabetic testing supplies. The caller says Medicare covers 100% of the cost. They just need your Medicare number to verify your eligibility and process the order. This is one of the oldest and most profitable Medicare scams in existence. And according to AARP and the Senior Medicare Patrol, it continues to generate millions in fraudulent claims every year. Here is what actually happens. Once scammers have your Medicare number, they bill Medicare for expensive, durable medical equipment, often items worth thousands of dollars. You may never even receive the equipment, or you may receive a cheap, low-quality item worth almost nothing while scammers pocket the difference. In some cases, you receive nothing at all. But Medicare gets billed, and those fraudulent charges now appear in your name on your Medicare record. The rule that protects you from this scam is simple. Legitimate medical equipment suppliers do not cold call you. They do not contact you unsolicited offering free equipment. They work from a prescription that your doctor has already written, and they work through established medical supply channels. If you did not ask for it, and a stranger is offering it for free, it is a scam. Hang up. If you are genuinely interested in a medical device or supply, ask your doctor at your next appointment. Scam number 3, the Medicare Flex Card scam. This one has exploded in 2026, and it is being driven by misleading advertising, not just phone calls. You may have seen ads online, in the mail, or even on television, promoting something called a Medicare Flex Card. The ads claim you can receive a card loaded with money, sometimes as much as $900 or more, to use for groceries, utilities, over-the-counter medications, or dental care. Some ads claim you can get money back on your Social Security check. These ads are specifically designed to look official, to mimic the look and language of real Medicare communications. Here is the truth. Some Medicare Advantage plans do offer supplemental benefit cards or allowances for specific qualified beneficiaries, particularly those who also have Medicaid or meet specific income requirements. These are real benefits that exist for a small subset of enrollees. But the ads you see targeting the general Medicare population are almost universally misleading, if not outright fraudulent. Many of the companies running these ads are marketing firms trying to sell you a Medicare Advantage plan, collect your personal information, or in some cases, steal your Medicare identity. The $900 figure and similar large amounts are almost never available to the average Medicare beneficiary. What to do if you see these ads? Do not call the number in the ad. Do not fill out any form with your Medicare number or Social Security number. Instead, call your state health insurance assistance program, also called SHIP, at 1-800 Medicare for a referral to a free unbiased counselor in your state. Scam number 4, fake telehealth and genetic testing. In 2026, two newer scam categories are growing rapidly. The first is fake telehealth. You receive an offer for a free virtual wellness visit, a balance assessment, or an at-home diagnostic test. The offer sounds medical and official. All they need is your Medicare number to process the appointment or order. What scammers are actually doing is using your Medicare number to bill for telehealth services that never happened, or to enroll you in fraudulent recurring telehealth charges that can take months to discover and dispute. The second is the DNA or genetic testing scam. You receive a call or see an advertisement offering free genetic testing or cancer screening covered by Medicare. The messaging is often fear-based. You might be at risk. You should know your genetic status. Medicare covers this at no cost to you. In reality, scammers collect your Medicare number under the pretense of processing the test order. The test may never happen, or a real test may be performed. But scammers bill Medicare for far more expensive genetic panels that were never ordered by your doctor. According to the HHS Office of Inspector General, fraudulent genetic testing claims have cost Medicare hundreds of millions of dollars. The protection for both of these scams is the same. If you did not initiate the contact, and if your own doctor did not recommend or order the service, do not provide your Medicare number. Any legitimate medical service starts with your own doctor, not a stranger calling or emailing you. Scam number 5, and this one is the most dangerous of all, the Medicare impostor call. This is the most frightening of the 5 because it combines urgency, fear, and official-sounding language to create immediate panic. You receive a call claiming to be from Medicare or from a Medicare compliance office, or sometimes from law enforcement working with Medicare. The caller tells you that there has been suspicious activity on your Medicare account. Your benefits may be suspended. There is a fraud investigation. You need to verify your information immediately to protect your coverage. In some cases, in 2026, these calls now use AI cloned voices, making them sound even more official and professional. Here is what you need to understand. Medicare does not call you to tell you your benefits are being suspended. Medicare does not have a compliance office that calls beneficiaries. Law enforcement does not call you to discuss your Medicare account. And if there were ever a genuine issue with your Medicare coverage, you would receive written communication by mail first, before any phone contact. The urgency and the threat of losing your benefits are the entire mechanism of this scam. They are designed to override your judgment and make you act before you think. If you receive one of these calls, do not stay on the line. Do not confirm any information. Hang up immediately. Then call Medicare directly at 1-800-63-34227 to verify whether there is any actual issue with your account. There almost certainly will not be. Let me give you 3 rules that will protect you from every Medicare scam that exists. Rule 1. Medicare will never call you out of the blue and ask for your Medicare number or Social Security number. If you did not initiate the contact, No one from Medicare is calling you for your personal information. Rule 2. Medicare will never send someone to your door to sell you anything or verify your enrollment. Anyone who shows up at your home claiming to represent Medicare is not from Medicare. Rule 3. Medicare will never threaten to cancel your benefits if you do not provide information immediately. Urgency and fear are the tools of scammers, not of government healthcare programs. If someone violates any of these 3 rules, the call is a scam every time. If you believe you have given your Medicare number or personal information to a scammer, act immediately. Call Medicare directly at 1-800-633-4227. Report what happened and ask them to flag your account for suspicious activity. Report the scam to the FTC at reportfraud.ftc.gov. Contact your state health insurance assistance program for free local help navigating what to do next. Review your Medicare summary notices regularly. These are the statements Medicare sends showing what claims have been filed in your name. If you see charges for equipment you did not receive or services you did not use, that is evidence of fraud in your name. And please share this information with everyone you know who has Medicare. The seniors most at risk are those who have never heard of these scams. A 5-minute conversation with someone you love could protect them from a devastating loss. Your Medicare number is worth money to criminals, not because of what it can buy them directly, but because of what it lets them steal from the government in your name and what it tells them about you as a potential target for further fraud. Protecting it is not complicated. It just requires knowing what to watch for. You now know. Share this video with every Medicare beneficiary you care about. Subscribe if you haven't already, and I will see you in the next video. Stay safe and stay protected.